Many people think high blood pressure, high blood sugar, excess belly fat, and abnormal cholesterol are separate health problems. But they often occur together as part of a single condition called metabolic syndrome. When these risk factors combine, they significantly increase the chances of developing heart disease, stroke, and type 2 diabetes. So what exactly is metabolic syndrome? Metabolic syndrome is a group of health conditions that occur together, rather than a single disease. A person is usually diagnosed with metabolic syndrome when they have several of the following: increased waist circumference, high blood pressure, high blood sugar, high triglyceride levels, and low HDL, often called good cholesterol. These conditions are closely linked because they often develop from the same underlying problem, insulin resistance. When the body's cells stop responding properly to insulin, the pancreas produces more insulin to compensate. Over time, this affects the way the body handles glucose and fats, while also contributing to higher blood pressure and increased fat storage around the abdomen. Excess abdominal fat is particularly important because it is metabolically active. It releases hormones and inflammatory chemicals that can worsen insulin resistance and increase inflammation throughout the body, creating a cycle that makes the condition progressively worse. Most people with metabolic syndrome have no obvious symptoms. They may feel completely healthy while these risk factors slowly damage blood vessels and organs over many years. That's why regular health checkups are so important. Several factors increase the risk of metabolic syndrome. These include obesity, physical inactivity, unhealthy eating habits, aging, family history, poor sleep, smoking, and certain hormonal conditions. If left untreated, metabolic syndrome greatly increases the risk of type 2 diabetes, heart attack, stroke, fatty liver disease, kidney disease, and other cardiovascular problems. The understanding of metabolic syndrome has improved as scientists discovered how obesity, insulin resistance, inflammation, and metabolism are connected. Rather than treating each risk factor separately, doctors now recognize the importance of managing the underlying causes. Treatment focuses on healthy eating, regular exercise, weight loss when needed, quitting smoking, improving sleep, and controlling blood pressure, blood sugar, and cholesterol with medication if necessary. Addressing multiple risk factors together provides the greatest health benefit. Today, artificial intelligence is helping doctors identify metabolic syndrome earlier by analyzing electronic health records, blood test results, blood pressure readings, waist measurements, wearable device data, and lifestyle patterns. AI can estimate a person's future risk of diabetes and heart disease, identify which risk factors need the most attention, and help create personalized prevention and treatment plans. Metabolic syndrome is not a single disease but a combination of conditions that work together to increase the risk of serious illness. Understanding how these risk factors are connected highlights the importance of early detection and long-term healthy lifestyle changes. We've now explored how the body regulates blood sugar and metabolism. In our next section, we'll move to the kidneys and urinary system, beginning with how the kidneys work and discovering how these remarkable organs constantly filter your blood and maintain the body's internal balance.